The Alcohol Health Alliance has been leading the way on reducing alcohol harm, and I want to thank you, Sir Ian, Anu, Poppy, Lisa, and all the member organisations who, despite the lack of political will, continue to fiercely advocate for evidence-based policies that save lives and lift the public health burden of alcohol. Last month, it was 6 years since I was elected to the House of Commons. 4 years ago since I began my journey of sobriety, and 2 years since I spoke in the House of Commons, and I became the first member to openly talk about being in recovery. And I really hope that I'm not the last, because since then we've established AA meetings in the Palace, and one of the joys of my role has been to really support colleagues and others who need the support that I needed all those years ago. And I felt that I had a choice, really, to keep my recovery a secret or become an advocate and try and champion visible recovery. And it's lovely to know that together we're making a difference, not just in this place but in our communities, and I hope that we will change the lives of many more people in the years ahead. It's with the support of the Alcohol Health Alliance that we've been able to call out a decade of inaction, broken promises and scrapped initiatives in politics on alcohol. The last alcohol strategy was in 2012, and it is utterly shameful that there is no plan to address one of the biggest public health crises across society. Approximately 70 people die every single day across the UK from alcohol. It's the largest risk factor for death, ill health and disability for people between the ages of 15 and 49. And it is estimated to cost, but just remember that this estimate is now over 10 years old. It's estimated to cost society upwards of 27 billion. And the fact that that cost has not been re-evaluated for the modern era is quite truly astonishing too. So what has led to alcohol harm reaching such an all-time high? Well, we know there is a stigma around alcohol issues. There is also a powerful industry and lobby that operates in this place. And we've seen so many promises made and quickly broken. And I think the power of the industry is something that we're all aware of. And sadly, a lack of political will. Why is government action lagging behind on alcohol compared to obesity, tobacco, gambling and illicit drugs? It makes no sense when alcohol causes the most harm. So it is the World Health Organization and other organizations that tell us the measures that work. And these include reducing the affordability, the marketing and availability of alcohol. I'm delighted that the Alcohol Health Alliance has agreed with those policies in its most recent report. And yet, despite this, no political party yet is willing to commit to specific plans to tackle alcohol harm. But Andrew, I'm looking to you for when you make your contribution this morning.
No pressure.
I believe we need an independent review of alcohol harm to scrutinise every aspect of the harm, the cost to society and the measures needed to tackle it. The need for that independent report and the independence of it cannot be overstated. Evidence shows that the global alcohol industry is working to influence policy at an international, national and local level in order to favour business interests. So policies must be developed independently of groups with a vested interest. Today's report from the Alcohol Health Alliance highlights the impact of alcohol marketing. There is simply no escape from it. Whether it's on public transport, billboards, TV and sports sponsorship, turning on the radio, pop-up ads on social media and promotional offers through the letterbox. There is no option to opt out of alcohol marketing. And there's substantial evidence that exposure to alcohol marketing leads to children starting to drink earlier and more than they otherwise would. And people in recovery tell us that alcohol marketing makes staying sober even harder. And advertisements can be a trigger for relapse. I'm working closely with ASDA to improve their marketing practices, and I'm hopefully going to be able to share with you some new initiatives in the coming weeks. The Alcohol Health Alliance's new report finds that half of respondents support measures to regulate alcohol advertising more, with 66% of people supporting a mandatory health warning on alcohol ads. What I think is truly astonishing is that it's not just about the marketing, but alcohol labels are not even required to display the same health or nutritional information that a bottle of orange juice. So people aren't even being given the basic tools to make informed decisions about their health and consumption when it comes to alcohol. How is that acceptable? And I want to congratulate the Irish government for its pioneering efforts to introduce mandatory health labelling on alcoholic drinks, including calorie content, grams of alcohol, risks of cancer and liver disease, and dangers while drinking while pregnant. Alcohol, like tobacco and asbestos, is a Group 1 carcinogen and linked to over 100 illnesses. So I hope a future Labour government will follow Ireland's example and put mandatory health labelling on alcohol products. So there's so much more I could say, so many different issues that link to alcohol harm across society, but just let me close by thanking the Alcohol Health Alliance for this report, calling on all the parliamentarians here today to listen and to do what they can to influence change at government level, because we cannot afford to wait any longer. Thank you.